To my YouTube channel Sun Dental. I am Dr. Ashish Ranjan. I practice in Rohini, Delhi. Today we'll discuss about OPG. Why does a dentist recommend or suggest you to get an OPG? Most of the time when I tell my patients to get an OPG, they ask question, why do you require? I've already got my treatment done. Please explain. So this is an OPG and X-ray. So we'll talk about this. The medical terms will not be discussing it. It is for our use. But through OPG, we can come to know a lot of things about the patient. Because my approach of treatment is to ensure that the patient doesn't get problems, dental problems in future. Because what I feel, dental problems is for those people who doesn't take care of their teeth, who have lack of knowledge in terms of how to keep oral hygiene well. In OPG, what all we see, this is a OPG of a patient whose age is around 6 years. So this is a case where we get all the permanent dentition, anterior permanent dentitions. These are the tooth, which is a deciduous tooth or a milk tooth. We can see the eruption of cysts, which is happening on all the four quadrants. The tooth bud for 7 is already intact. Apart from this, if there is any cavity, any decay, or any kind of other changes which we can look into this, and accordingly we can suggest and ask my patient to follow some of the preventive measures so that the child doesn't have a problem. So today I'll be bringing a lot of x-rays just at a different age. This is a OPG for patient whose age is 12. This is a complete mixed dentition phase. Almost all the permanent tooths have been erupted, except barring few, which you can see here. The important is not that you recognize which is the tooth which is not erupting, but for me prescribing an OPG is just to have a complete knowledge about the oral dentition, soft tissues, and any other changes or any other losses which is happening. Now, once we are moving from 12 years to an adult OPG, so we'll find a lot of change. Like this X-ray is of a lady whose age is 33 years. Now, in this, what I generally am looking in this, that this is a decay. Patient is not coming for the complaint of this particular tooth because there is a good difference between now pulp and the decay. So patient yet has not got any kind of sensations or pain. But yes, I can see the changes what is happening at a pathological level. Here the root stumps are there. This is a missing tooth. This tooth has tilted mesially because sometimes way back she has got an extraction done. Post that she has not got a bridge done or an implant. This is the right place for an implant case also. Here again we have a missing tooth. This white color is an artifact. So she was wearing a nose pin while taking this X-ray. This is a small filling and there is a decay, grossly decay from both mesial and distal side. Then what is important to look at this age is about the periodontal ligament attachment with the tooth, gum recessions, the pocket formations. Then you have these nerves, but right now since we are not teaching you the medical science that this is a mental nerve, lingual nerve, then mental nerve, then this is mandible, this is maxilla, this is ramus, this is... So these medical terms is not required because the purpose of video is to give you fair idea. Next time when your dentist or when I prescribe to my patient that I need an X-ray, my major purpose is to give you a better dentition in terms of for helping you in maintaining better dentition. So I need an OPG, and this is a patient whose age is 55 years. Now you see, I think so he has not taken care of his oral hygiene very good at his young stage. Therefore he has missed all his molars, posterior tooths. On maxilla, if you see, he has bridges intact, and there is a secondary caries under the caps, and there is a decay at the adjacent tooth of the cap where the placement has been done. Some caries are starting, is in an initial stage, yet patient is unaware. So when I get these kind of X-ray, post treatment or before treatment, I suggest patients, suppose the patient complains of this area or this region of a pain, but I suggest him, okay, fair enough, this we will solve right now, but going forward you may have problem in this tooth, you may have problem this area, you may have problem this, you are not brushing properly, or any kind of other problems we suggest. So why I brought this topic today was that if you want to take care of your tooth, because my purpose of video is to have all my patients and people around the globe a natural teeth till last, where he can enjoy all his foods. So we'll conclude. OPG is very good for us to visualize the diseases for future which you are going to have. Thank you so much. If you have liked my channel, please subscribe. You can share also. Please give your view. This gives us motivation to bring a lot of videos, educational videos. Thank you so much.